Hi Dennis, I was just starting to hear about your retirement. In fact, I think disheartened is a bit of a misnomer. I think devastated is probably more of an appropriate term. Jim Ellesmere reached out to me and told me about the Dalhousie MIS YouTube channel, and I was honored to be asked to say a few words. I also took the opportunity to hear the numerous accolades from yours and our distinguished colleagues, and there's no questioning this sincerity and the deep felt respect that you've earned and are due. You're a legend and an icon, no question. Now, I could go on and on about your technical prowess, like your ability to operate fluidly in mirror image, how your brain knows to go left when your eyes are telling you to go right. It's a wonder to behold. I still remember that, 12 years later, on how skilled you were at that particular approach. It's extraordinarily hard to do. Only few people can do it, and you were definitely a master. I remember you used to say, don't grab the bowel. Use the grasper as an oar to move things out of the way because it's delicate. That sounds easier than it is to actually perform, but you made it look easy, like you do everything. And that's kind of what I remember most is the ease at which you did things. To put it another way, what makes you different or sets you apart is you. You don't get flustered. You're calm, cool, relaxed, and that's you. Half-hour adhesiolysis, 3-hour adhesiolysis, no difference. Same Dennis. Before, during, after. And I try to challenge that inner calm. When I'm faced with a challenge, I have varying degrees of success. I mean, there's only one of you, and you'll always be the master. But please know that when I'm having difficulties, I try to channel that inner calm. One of the other things that I really enjoyed about working with you was your encyclopedic knowledge of both the surgical history and the culture of surgery and its development. Whether it was the time you met Harry Hassan, or who owned the subsidiary of Tyco or Auto Suture, you're a wealth of information. You not only knew who built every kind of surgical stapler or hernia mesh, you took the time to know why they built it and to understand the engineering behind it and how that would benefit this patient or that patient or this technical approach or that. There wasn't any part of it that you didn't absorb, that you didn't completely try to immerse yourself in. And there's no question that is a complete boon to the department, to your patients, and when health authorities allow us to choose the equipment and the patches that we use, there's no question that you would know every aspect about every detail and what would benefit people the most. And that was natural to you, that curiosity. It's authentic. It's not forced. You didn't try. You just were genuinely interested in what we do, why we do it, and how we do it, the tools with which we apply our trade. And I've tried to embody that with how I approach problems and treat my patients. If I had to sum you up in one word, it's just that. You're authentic. There's no pretense about you. It comes through in every single thing that you do, and it just made you a pleasure to be around, a pleasure to learn from, and a pleasure to carry with me as I go through life and through my career. I've learned from you immensely, and I can't wait to see you when you come back home to Winnipeg. I'm looking forward to that. Take care, Dennis. Love you, man. Bye-bye.